Hey everybody, Gena Kirby here. Thank you for joining us today on our discussion about breastfeeding. This is me live from my bedroom, and little Jack is sleeping. He's sleeping in his little bean bag next to me. I'll grab him probably in a little bit to nurse him. This is me in all my glory. I'm almost at 40 days postpartum. I did that lying in thing. It's fun. So I'm joined today by a holistic IBCLC extraordinaire, amazing woman and good friend, Jennifer Tao. And she and I are going to be discussing everything that's been going on with me breastfeeding-wise. So thanks for joining us, Jennifer.
Oh, thank you, Gena. It's always fun to talk with you.
So let's get started. I want to talk about first things first. So when I started nursing Jack, day one, I thought, wow, this kid's got a little teeny tiny mouth. How am I going to shove this big boob in his mouth? How am I going to do this? But he got on, and it's been 5 years since I nursed, so about 5 years. So it had been a while, and I was like, oh, is it supposed to feel this way? It kind of felt familiar. I was just excited that he went to the breast at all. And then it wasn't until day 2 that I realized it's not working. He shouldn't be at the very end of my breast. What's going on here? And that's when I reached out to you, and that's when we first started talking about the possibility of tongue tie and lip tie, which it turned out Jack had both. But can you speak to moms about just what that is?
Yeah, but before I do, there are a couple things that you just said that I think are important. The first one being that you had nursed 3 other children, but I always tell a mom when she's nursing another newborn, remember that the last child you nursed pretty much did it themselves. Your experience of nursing a newborn lasts for about 6 or 8 weeks with each child. So when you nurse for 2-3 years after that, your experience of nursing has just been nursing a toddler. Mm-hmm. And so when something is challenging, like what you just experienced with Jack, it's very easy to second guess yourself, to think, oh, it's just that I don't remember. And it's true. And so a lot of mothers kind of push aside their intuition that says this isn't right and start to rationalize that it's because, I haven't nursed a baby in a while, it's a different baby, all of those other kinds of things. And often what you'll see people say, of course, when you maybe post it on Facebook or say it, mention it to some friends is, oh, don't worry, it takes time, babies get used to it, you get used to it, nipples toughen, all those kinds of myths start to fly at you, and you start to second guess yourself. So I really want to encourage mothers that when they're feeling that something's not right, it often is the case that something's not right. Now, it could be as simple as they just need a little bit of latch assistance. It could be that the baby needs some body work, but in your case, it was much more than that. But just to really remember to trust that, what you're feeling is probably correct. The other thing that's really interesting is that you had a home birth, and most moms are having hospital births where someone outside of themselves is telling them what they should expect. And those hospital births are often managed in a completely different way, aside from the birth experience, which could be, highly medicalized, baby could be medicated, mom's been medicated, and they're sort of overcoming that. There's also that hospital checklist that those nurses need to check off, that the baby has nursed a certain number of times or has pooped and peed a certain number of times, and that often also overrides the mother's instincts and intuition, because it's someone external saying everything is okay based on a checklist. And
yeah, it does. It totally does.
Exactly. And so if you had been in that kind of situation, on day 2, someone would have been saying to you, well, Gena, your milk's not even in yet, wait till your milk comes in, and sort of, again, circumventing what you were feeling and thinking. And I think that's one of the most important things about, what I see happening for moms is that 2 weeks out, 3 weeks out, 3 months later, they're still suffering the reverberations of not having been trusted or trusted themselves. So I just wanted to mention that piece before we got into the tongue-tie bit. And oftentimes, moms have the opposite experience of you, where nursing seems to be fine in those first 2-3 days until their milk comes in. Because tongue-tied babies often can't manage flow. They can't manage the suck-swallow-breathe synchrony. So they do okay when there's small volumes like there is with colostrum. And they do okay when a breast isn't really full, like it is when your term milk is in. So often those babes will seem to do fine in the first day or 2 or 3, and they go home, and that's where everything falls apart. You have initial pain right from the start. So I just want to remind folks that with tongue tie, you can have either end of that spectrum or anything in between, where you've got that pain right off the bat, where that baby's hanging at the end of your nipple, the tongue is rubbing like a cat's tongue, like sandpaper on your nipple.
Oh my God, yeah.
Exactly. That can happen, or you can have the other end of the spectrum where there's no discomfort at all until the milk comes in, or even then there's no discomfort, but the baby is compensating in crazy ways, in choking, sputtering, pulling off the breast, spilling milk. I just want to remind moms that whatever experience we're talking about for you, there's also a wide range of experiences that mothers will have with babies who are tongue-tied.
So I have a quick question. So when there's times when Jack's at the breast, even with the new way we're nursing, which I'll share with you later, like here's my Jack, here's a big boob, and he's at the nipple, and he does this. He goes, and he like pulls back and away.
Yep.
And he's like, I don't even know how, I'm trying to describe it. He kind of gets like really cheeky, and he pulls at my nipple while he's holding on.
And what I've noticed about Jack is, again, this is a progression, but what I even noticed over the last couple of days when I looked at the pictures you've posted is that he still has a lot of structural issues. He still has a lot of structural asymmetry, and one of the things that's very noticeable is I always remember the Rocky Horror Picture Show in the film where they talk about the guy's got no neck. He's got no neck. Jack's got no neck. He can't really go into an extension. So instead of just tipping his head back, he has to pull his whole body back. So he's pulling his whole upper body in order to get the same kind of movement that a baby gets simply by tipping their head back. And you'll see that very commonly with a baby who's still stuck. And, I know he's had a lot of body work. I know you've been told 5,000 times. But sometimes, these kids take time, and things release in layers. And the most challenging compensations for babies to release, or the most challenging restrictions for babies to release, are the ones that seem to have, really had their beginnings in utero. So where the baby probably developed with, say, a mild torticollis, where that problem really laid itself down in the fascia for practically 9 months. And so those kids kind of keep returning to that pattern, and it takes a long time for the body worker, whether it's chiropractor, craniosacral therapist, osteopath, whoever you're working with, to kind of get beneath the obvious issues and get underneath and get that fascia to release and unwind. With these kids, what I normally will recommend, once the chiropractor or craniosacral therapist, whoever you're working with, has kind of taken care of and addressed, the obvious restrictions, is to get in there and do a fascial unwinding. And I don't know what your chiropractor's done, so I'm just sort of speaking generally here.
Okay.
But where I see those kids kind of continue to come back over and over and over again to a certain pattern, and that pattern is often what you're describing with Jack. And interestingly enough, where that pattern doesn't release, those are the kids who often army crawl later. They can't get up into that all fours and crawl correctly. So they often will army crawl. They're often the kids that moms will say at like 3 to 4 months, I can only nurse them lying down. Like their compensations kind of continue. And you'll see, kind of things over time that when you look back, you can find out that was the kid who was always pushing off mom's chest or pushing off the breast. So that, as a matter of fact,
what's the army crawl? Because my Uma and Charlie used to scoot on their butts and never crawled.
Yeah, well, army crawling typically is pulling themselves along. Think about a soldier. They're down on their bellies, and they're crawling along, pulling their arms, but they're kind of dragging their legs because they're trying to stay low and not be seen. So that's why it's called an army crawl. So those kids don't get up on all fours. And oftentimes, I remember I just had a client that I spoke with over the weekend who her baby got a fascial unwinding and for the first time got up on all fours and crawled, like immediately after the unwinding. And that's one of the things I've seen very commonly is with tongue-tied kids that I don't see right away. Like with Jack, I see them at 3 months or 4 months, and we get the tongue tie released, we get them in for body work, and something functionally changes immediately. Whether they couldn't roll to one side, they only roll to the other. They couldn't roll at all. They're a little bit older. They're maybe 5, 6, 7 months. They suddenly start crawling correctly. Those things become possible for the baby once those restrictions are released. So, for example, I noticed somebody had commented on your page when they were, sort of noting your baby, and someone said, "Wow, look at him hold up his head, a strong boy." That's a red flag for a lactation consultant who understands structure and function. A baby should not hold up their heads at a day or 2 old. That's a compensation. That's a baby who is very, very tight and needs release. So it was very clear in Jack from the beginning that he had structural restrictions. It didn't have to be tongue-tied that could do that. Lots of restrictions could do that. I noticed that I got a lot of the comments that I get on Facebook on my pictures really shown me that we have so much to learn as parents, and especially doulas and even lactation counselors, that there's a lot of myths and things out there that we've grasped onto and share with others. I think that one of the things that is nice about social media is that it gives people support where they might not otherwise find it. If you came from a family that never breastfed, none of your siblings breastfed, and you feel really alone in that, you can find your tribe. By tapping into social media and feeling like someone else is saying, "You go, girl, don't give up, don't quit." I went through that, and it can be very supportive. Sort of like where La Leche League started with that idea that you're not the only one doing this. The problem then comes in. I was a La Leche League leader for 17 years and active, only for about 7 or 8 of those years. But it's sort of the same idea with facilitating a La Leche League group, but you're trained as a leader to do that. And unfortunately, you've got a lot of Facebook pages out there where someone's interested in breastfeeding, starts a page, doesn't have any of that kind of facilitation training, any ability to recognize where something is really going to take someone down the wrong path. And you start to get a lot of people wanting to be supportive. It's really from their hearts, but they only have their own experience. Whether they've nursed 1 kid or 5 or 10, that's not the experience of somebody who's seen hundreds or thousands. And it changes your perspective when you've seen lots and lots and lots of kids. And so you often see someone respond with, look at them hold up their head, whereas you would hope a lactation consultant would know better than to say that. Or would they say something like, I see this very commonly. A new mom, first-time mom, posts that her baby's losing weight, her baby's 4 weeks old, hasn't gotten back to birth weight, the pediatrician wants the baby on supplements, and everybody rushes in to say, "Well, are you small? Is the dad small? It's normal for babies to grow this way." It's not normal. And I see kids where the red flag is telling me that kid's probably starving, and everyone's rushing in to be supportive. And you understand why, because someone probably didn't support them, and they sure don't want that mother to quit breastfeeding. But the best advice I could give for people who post on Facebook, whether it's to your friend or whether it's to a page, is don't ever respond without asking at least 2 questions, because you're usually responding to the wrong thing.
Well, yeah, everybody's responding through their own filter, through
Exactly.
their own experiences and what they know, whether it's they've helped 100 people or they just had 2 kids. They're going to respond through their own filter. I want to let everybody know that if you have a question for Jennifer or myself, or you want to share a story, that I'd like you to go to Progressive Parenting on Facebook. It's just facebook.com/progressive parenting. And I started a little box that says ask your breastfeeding questions here. So if you have any questions for us, go ahead and ask them there. Do know that the questions will not be anonymous. So you can go ahead and ask them there. Or what are we looking at here? Oh. People ask questions here? Oh, it shows up here. I'm not getting it. How do I see this?
I can't see anything.
Okay, well, go ahead and get into me.
Except
Whatever.
you.
Oh, okay then. I do have, forget what I just said about the whole progressive parenting thing. Listen, I'm just nursing a baby. That's all I do. All the other stuff Craig does, he just came in and he's like, "No, silly, it's right here." So I do have a way to figure this out. And one of the chat questions is what does fascia unwinding look like? Okay, and I have 2 more questions after that, so let's keep the answers as short as possible if we can.
Right, so from the outside, what it usually looks like is the body worker supporting the baby at the cranium, at the base of the occiput, and at the sacrum, and really just following the baby as the baby really unwinds their own fascia. It's really just trusting the baby and giving that baby that sort of permission and information to unwind. So what it looks like often is the baby kind of moving through space, and frequently the baby will track their birth. You'll often see the baby looking like they're actually going through the cardinal movements and coming through the birth canal. Not all body workers know how to do fascial unwinding. So sometimes you have a great chiropractor or craniosacral therapist or somebody and just take the baby to someone else for the fascial unwinding, and then everything kind of goes well from there. So yeah, that's what it looks like.
Awesome. Okay, someone else asked, due to weight loss and supply issues, I needed to supplement, and I was lucky enough to get donor milk. We use tube feeding. Now I find that even though she can latch, we have a couple of sessions of good latch and suck, then she just pushes away and refuses the latch. How do I encourage her without resulting in distress? Ooh, I went through that too.
Well, the age of the baby, see again, so often there are more questions to be asked there than answers, like how old is that baby? Because how you approach a 2-week-old...
Sorry, she had a follow-up which answers that. She said, however, now hearing you talk, at 3 weeks she can hold up her head. Clearly we need more work than just chiro, and it's going to take tons of time.
Well, it doesn't always take tons of time. It's only a 3-week-old. Part of the issue is finding people with the kind of skills that you need, and it's very much integrative. You need a lactation consultant who really does understand what they're looking at in terms of structure and function, and more lactation consultants are. I mean, 20 years ago when I started referring to chiropractors, every other lactation consultant except for probably 2 in the world thought I was crazy. And I talked about it on LACNet for a decade before it became even a discussion. And now in the last 2 or 3 years, almost every lactation consultant with some awareness is talking about bodywork. So it's becoming easier. I wouldn't assume it's going to take a lot of time with a 3-week-old. If you're not getting the care, if you're not getting the results, look at what else might be going on, whether you need a different body worker, whether you need your lactation consultant to be involved and help you with latch issues, because you can do all the body work in the world, but if you don't know how to make those modifications in latch or maybe some suck training, it's not going to work. So you really need that collaboration.
Okay, awesome. Yeah, that's the thing. I think a lot of, like I didn't know about craniosacral therapy until Charlie was already not nursing anymore. So I think a lot of parents just don't know what their options are or who they need to see.
Right.
And how do you feel about second opinions? I think because not all IBCLCs are the same, not all doctors are the same. Like you're not going to, just because you're going to go see an OBGYN doesn't mean he's like the best OBGYN ever.
Right.
So, you know, how...
I think that, yeah, I mean, it's a really good question. I think that second opinion, you know, we all have the right to all the information we need. We all have the right to the outcome we want. And if someone's not supporting the outcome that you want, then you have the right to go and look for that support somewhere else. What I see as a problem is that the way Facebook, you know, it's very challenging to say, be a lactation consultant. You spend 2.5 hours, I spend 2 to 2.5 hours on an intake with a mother. Give them information and have them go and post on Facebook and ask 5,000 of their closest friends what they think of my advice. I mean, that's very challenging. Whereas if they actually implement the things that I've said, and something's not working, I would hope they would come back and say to me, hey, I tried this, because this is not a science in the way that other things are a science, and this is very much an art, and if something's not working, we have to try it again, try something else. But if you've actually really tried what I've told you to do, or someone else has told you to do, and you're getting nowhere, yeah, find someone else. Whether that's a midwife or a doctor or a specialist or a lactation consultant or whoever it is, but communicating back with the person you're actually working with, because what I often see happen is people will come say onto my page, Holistic Lactation, and they'll say, my lactation consultant told me to do blah, blah, blah. What does everyone think? And everyone starts telling them not to do it. And I come back and say, wait a minute. How are you going to know if that even worked if you don't do it? If you have some concern with what the person said, go back and say, wait. Why did you tell me to do this? Because someone said, and I don't mind if someone comes back to me and says, hey, I know you told me to do these exercises, but someone else told me that this could be the outcome, and I can explain why I told them to do those exercises. So really, that lack of communication with your provider can send you down a path that takes so much longer to get the care that you need. But in terms of second opinions, I'm often the second opinion for a lot of moms. And I'm often their fifth opinion. Finding someone with the expertise for the problem that you have is worthwhile. So instead of just looking for, you say you had a high-risk pregnancy, you're having triplets, you wouldn't necessarily find somebody who'd never attended a triplet birth. If you have a problem, or at least a twin birth, if you're having tongue-tie problems, for example, you could find the very best lactation consultant in the world, but if that person has never worked with tongue-tie, that might not be the person for you. So don't be afraid to say to someone, what's your experience? What's your expertise? Make sure the person's an IVCLC to begin with, not a person who took a course. Make sure they're actually a board-certified lactation consultant, and then say to them, how many babies have you worked with tongue-tie? I've worked with thousands. Find out what their expertise is. Find out if they don't have a lot of expertise, are they willing to consult with someone else and at least see through it? Does that answer that, Gena?
I think so. Yeah, perfectly. There's a couple more questions now. What questions can I ask the lactation consultant, as I have seen two who keep telling me I'm doing everything right, but I need more time?
Well, it always troubles me when anybody looks from the outside and tells the mother they're doing everything right, because breastfeeding happens inside the baby's mouth. So first off, does that lactation consultant know how to do an oral assessment? Have they done an oral and functional and structural assessment on your baby? Do they know how to look at that baby and see if they are structurally functional? Do they know how to do an actual oral assessment? Do they know how to look for tongue tie and lip tie? Do they know how to do a suck assessment on that baby? Do they know how to teach you exercises to help strengthen maybe a weak suck? To help strengthen maybe a weak
on you. So you know how to do it, what it feels like.
Yeah, right? Yeah, and do they know how to do those things? Do they understand just what Gena and I talked about at the beginning, when a baby is doing exactly what Jack is doing, that pulling back in the breast? Do they say something like, oh, some babies do that? One of the worst things you ever hear is, some babies do that. My question is always, why does the baby do that? I want to know why the baby does that.
I was told that by two IBCLCs with Charlie, who ended up, now I know you've seen it, she has hardcore tongue and lip tie. I was told some babies are just like that.
Yeah.
By two IBCLCs.
When it's dysfunctional, some babies are not just like that. When it's something like, some babies are blonde and some babies are redheads, okay, I'm with you there. But when we're talking about function, no, some babies are not just like that. And there are places where I don't know why a baby's doing a certain thing. That doesn't mean it's within the range of normal. That means it's challenging me to go deeper in my education and knowledge and figure out why that kid is doing that, and if what they're doing is affecting that breastfeeding relationship. Because babies are brilliant compensators. They rewire so fast. And moms are brilliant in response to their babies. So we help them rewire. We will do anything to get them fed.
Right.
We will. And so, we'll hang upside down if that's what they need. But that's compensation. That's not what we want to be doing. So, and so I've had mothers say, some babies, just need to nurse lying down. No, they don't. There's something wrong. That's a stability that the baby's gaining that they would gain if they got the correct bodywork instead, or the correct tongue tie release. So we need to sort of, be a little bit more of a Sherlock Holmes and stretch a little deeper. And if we don't know, say, you know what? I get that that's dysfunctional. I'm not sure why, but let me see if I can figure that out with you.
Awesome. Okay, cool. And then one last question for fascia unwinding. Is the baby face up, down, or down, and are you tracing the spine with your fingers?
No, it's nothing like that. It's not anything like that. The person is, I've done fascial unwindings with chiropractors, because two people are much easier than one to do the fascial unwinding, to have one person hold the baby at the occiput and one person hold the baby at the sacrum, and primarily the baby ends up off the table, being held by the people that are holding the baby, moving physically through space. So your baby's kind of moving through. And in my tongue tie webinar, I actually show a baby having fascial unwinding. So you actually tend to have the baby off the table and kind of moving through space, almost like you'd imagine they were moving through the birth canal. And no one's pushing that baby in any direction. The people who are working with the baby are following the baby. Okay? Anybody who knows how to do fascial unwinding knows they know how to do it, because it's a very specific kind of technique. So if you say to somebody, do you know how to do fascial unwinding, and they don't, they're going to say no. If they think, I can't imagine someone's just going to imagine they know how to do that. You probably can find, I'm pretty sure, on YouTube, some videos showing you fascial unwinding techniques.
Okay, awesome. Thank you for that. We're going a little over on time, so I want to finish up with tongue and lip tie here by just sharing that I did go see a doctor. I saw Dr. Cole in Fort Worth. He was so nice, so kind, very sweet. He really put us at ease right away. He came outside of the office into the waiting room to come say hi to us as soon as we got into the office. Very sweet. Met Jack, called him by his name the whole time. Oh, are you waking up? Somebody's waking up. We're waking up. Yes. So, anyways, he's a very nice person. The office staff was very kind, very knowledgeable, put us at ease right away. The procedure took 40 seconds for the lip, 40 seconds for the tongue. We went directly into recovery. They gave us lots of info, and we were out. We were done like in 20 minutes. We were shocked with the whole, like maybe 40 minutes long. But we got home, and I expected, you know, things to be great right away, and they weren't. And I think that's really discouraging for moms. Like, if you don't know that it's gonna take a while for things to get better, and it did get a little bit better, and it was better for a while, and his tongue started to come out of his mouth, which was exciting. But then just recently, so it was like 2-3 weeks after the procedure, I felt like he was regressing again, and he has been. And I had a lactation consultant come out, and she said that she could feel like under his tongue, like that it was fibrous, and that there was like something kind of stopping her from doing a sweep underneath, and that I should go back and see Dr. Cole. Can people who go and get revisions expect to go back and have it done again, or like what can they do? It's really frustrating. So
I know when we had, it's interesting because we had this conversation, and I did tell you that it wouldn't be an immediate release, wouldn't be immediate, and I think mothers have a really hard time hearing that because they really want it to be that.
I know you said that. I remember.
No, so what I'm saying is that.
Would I believe that?
Yeah.
I want to believe that.
Why would you want to believe that? I totally get it, and that's why it's really important to have that follow-up and reassurance that, you know, remember that this is what we need to do, and we did exercises afterwards. It takes 21 days for the brain to repattern, and so many mothers find that about 3 weeks is where they really see a difference, a real improvement. However, if during that time you're sort of being a little bit lax with your aftercare, whether it's the stretching, whether it's the exercises, that sort of thing, then you're probably not going to get that repatterning to happen as quickly as it should. Bodywork's essential, and you had that, but a lot of mothers delay the bodywork. You didn't do that. I like my clients to have bodywork within 48 hours of the revision, and I like them to have it beforehand.
Right.
But yes, it is not going, think about it. You've spent, that baby, the tongue separates from the floor of the mouth at the end of the first trimester. That baby has been compensating since the first trimester of gestation. And it's not going to just immediately release just because the tongue is released. The muscle still doesn't know what to do. That posterior part of the tongue has never moved, and it has no knowledge of how it's supposed to work, and we've got to teach it. Often babies will immediately do better, and then the moms get very excited, and they back off on doing the stretching. They're not really conscientious about it because they think it's all better, and then the tongue starts to reattach because they aren't being really attentive to that stretching. So, and I think yeah, you said, yeah. So I know you, as you know, I contacted Dr. Cole and asked him to get you back in again, which he said he would. And unfortunately, this is a new area for a lot of us. I mean, we're really figuring things out, and one of the most challenging things for us, too, are these reattachments. They really upset all of us. But I do think that attention to the stretching and keeping that open and letting it heal open is a key, as well as the body work and the aftercare exercises, the oral exercises to strengthen the tongue, to strengthen the orbicularis, the lip muscle, and to help the baby to, you know, gain different function and let go of those compensations. Hey, gorgeous.
So, yeah, here's Jack. Hi, sweetie.
Hey,
hi. So, I was going to get him on the breast anyway. I'm just going to do it in front of you, and we could talk about it or not talk about it. I don't care, but I think he's hungry. Are you hungry? You want to show everybody what you do to tell me you're hungry? He's so sweet. Hungry? Okay, we have some questions too. So, I know, I'm coming. I know. Well, no. Do this so you can just put it right here and I'll read it. Because I was going to show everybody kind of how we're doing this. This one's going to fall. I hope it won't. Whoa, wait. No, wait. So I'm trying to get him up. Job, buddy! That's actually the best he's done in a while. Did you come back off of it? Yeah, you did. Let's try that again. Let's try that again. So, good job, bud. Good job. So, I'll spare you my giant breast now. Okay, so he's, well, actually, no, so you can see right here. And he just popped off again. You see how his lips
and what you're doing, which is really important, yeah, and what you're doing that's really important is you're bringing him from beneath the breast. You're letting him come chin to the breast first. Yep. You're doing an asymmetric latch.
Come on. Good job. But he ends up coming down again afterwards.
Right. And part of that could be either because his tongue is still restricted, so the only way that he can really manage to suck, swallow, breathe is to get far back on the nipple. Or it could be that he still has the kind of restrictions that cause him to want to go into this flex state, and of course he's going to pull down on the nipple if he does that.
And you can see, I don't know if you can't see the suck, swallow.
He looks like is he dimpling his cheeks, or is that just the video?
I don't see any dimpling.
Okay.
Hi, guy. So let me get to the questions and then move on. I was just saying I'm so glad that I don't shudder or scream anymore when he comes on. That was the Thrush. So I do want to make sure we touch on that, and we only have like 10 minutes for it now because we're a little behind. Somebody said some say wait and see, don't go to an ENT and revise, and maybe mom's experience will get better, and others say immediately see an ENT and get it revised as soon as possible because this needs to be taken care of. I'm sure it's different for every family, baby, and situation and practitioner. But Jennifer, can you talk about the between wait it out if baby is gaining weight well versus how much nipple damage pain a mom should put up with within the first week or two?
I think the most important thing to realize is that what's good for babies are good for moms, and it's never an advantage to a baby that a mother's in pain. Never. We're an ecosystem. What's good for one is good for the other. We're not supposed to tough it out. That is not normal. That's not healthy. You know, relationships depend upon pleasure. Positive, healthy relationships are pleasurable relationships, and this is about a relationship. I would say that now breastfeeding is the architect of the airway, the microbiome, and our relationships. All of those are being attended to through breastfeeding, and mom's feelings, her emotional feelings, her physical well-being are part of that. The baby wants that too. So we should never wait it out. And where else in healthcare do we ever tough out pain and misery and see if we survive it? Nowhere. That's insane. But I want to point out that we've got to stop using weight gain as our barometer for well-being. It's not. A mother who has a massive milk supply can have a baby gaining weight beautifully. If that baby is not efficient at emptying the breast, that mother's going to have a downregulation of her supply at around 4 months and wonder why she has no milk left. You know, we do so many things that are suppressive, like telling the mother to block feed, which I never use block feeding. It's a Band-Aid. We've got to stop using Band-Aids. We've got to look at full function of the mother and baby and see if the baby is fully functional. If that's a compensation, the baby's sort of managing to passively, you know, grow on an oversupply while the mother's in pain, that is not good.
Awesome.
I do want to mention that
there because we have so many questions.
I do want to mention that ENTs are rarely the person to see for a tongue-tie release. There are very few ENTs in this country who do proper tongue-tie release. Primarily, you would want to see the dentist who do release, but there are few. Just they're not my first go-to, except in rare circumstances.
When they go looking for that dentist, though, how would they like Google search that person? What do they need to put in to find that dentist?
They should be going to their lactation consultant. They shouldn't be going to the dentist anyway. This is a collaborative approach. You need the lactation consultant, you need the surgeon, you need the body worker.
Excellent. Awesome. Good.
So, as for Thrush, we can definitely, that's a quick one anyway. We can talk about Thrush very quickly.
Okay. Let's do that because I have 10 questions.
Okay. We're having a lot of, do you hear the vibrating though, or is that me? I hear
I hear it. I don't know where it's coming from. We'll have to figure it out.
So, okay, I hope people can hear. Basically with Thrush, you know, when I first started working with babies with Thrush, I had the same training as everyone else, you know, gentian violet, diflucan, nystatin. Diflucan really was just coming on as a treatment. Everybody was using nystatin and gentian violet. Nystatin was proven to be very ineffective as the as the candida was mutating. It was only being effective in about 40% of cases. Also, the baby putting the nystatin in the baby's mouth, it comes in sugar, so we're feeding the candida while we're supposed to be treating it. So I naturally started looking for solutions that were better than that, and for a while I was actually using grapefruit seed extract. This was 2 decades ago, up till about 15 years ago. And then I did the research on grapefruit seed extract and discovered the only thing that's antifungal about it is the preservative, so I stopped using that. And so I really went on a search to understand candida, to understand what was going on in moms. You know, candida is often, as you know, a side effect of tongue-tie because of that sandpapering of the nipples. And very frequently, mothers chase down that candida for 3 months, 6 months, and they'll never resolve it until they fix the tongue-tie. Usually it resolves very quickly once you fix the tongue-tie, if indeed candida is even present. Where it really is, where you feel like glass in the nipples, it's that burning in between feedings, that kind of thing. The treatment that I like, I just start with coconut oil. Coconut oil is antifungal. So I start with coconut oil. If that's not going to be sufficient, if it's already progressed to a place where it's just not sufficient, or the mother says, if I have that baby on my breast one more time, I'm done, then I use a silver spray, a silver hydrosol spray, and I have the mom just spray after she nurses once on each nipple and then apply the coconut oil. And if we need even more, I'll have her get calendula and mix it in with the coconut oil. They're all antifungal, they're antibacterial, very soothing, very healing. And then orally, I'll suggest the mom take biotin. Biotin is a B vitamin that interferes. Wow. Can you hear me? Because I can't hear you.
Yeah, I can hear you.
Okay. Biotin interferes with candida's evolution, so it keeps it from actually sending out those tendrils and taking over the gut. So I always have the mom use biotin, and then I'll also have her use a probiotic. Have the baby use a probiotic, and often put a probiotic around the nipples. That can help with the pain of the nipples as well. And what I'll do in the baby's mouth is like 3 days of baking soda. We don't want to do baking soda for a long time because we don't want to change the electrolytes, but just 3 days of baking soda, 1 teaspoon to a cup of water, swab the baby's mouth 5 or 6 times a day for 3 days. Usually clears anything in the baby's mouth. And then just continuing with the probiotic usually resolves it for the baby. The underlying key, though, and you know this, is nutrition. If you're craving sugar, if you're eating those white bread, dairy, sugar, all those carbs that are feeding the yeast, you were drinking orange juice because you thought you needed it with the calcium because you weren't eating dairy.
Yeah.
High sugar. So, we made those changes and got all that sugar out of your diet as well, and that cleared it up certainly a lot more quickly than if you hadn't done that.
It took 3 days to clear up the
But you were in a lot of pain. It wasn't a minor amount of pain you were in.
No, I was sobbing and crying, and yeah, it was horrible.
So that's the treatment that I use, and I find that it's very effective. Gentian violet is coal tar. I don't want that in any baby's mouth. I don't want that on any mother's nipples. It's toxic. It's a dye that's used in laboratories. It's not, just because something happens to have an antifungal property doesn't mean it's something safe. And there's just no reason.
Somebody told me that, why aren't you taking gentian violet? It was a midwife friend of mine who was mortified that I wouldn't do it. And I said, well, it's toxic. And she said, well, everything's toxic if you have too much of it. So is that...
Well, when you have the option of using, you know, coconut oil and calendula and silver, which are so non-toxic, versus coal tar, why would you choose the toxic substance? It just doesn't make any sense. Since so many things are toxic, why do we want to keep adding to our toxic load? Let's at least consciously do no harm. So
right.
that's the choice. And not, you know, as I said, nystatin is highly ineffective, and diflucan is a real strain on the liver. So and it depletes vitamin D, I believe. I don't quote me on which nutrient it depletes, but it depletes nutrients. So why bother? Why do that?
Okay, awesome. I'm so glad we talked about that. Someone said I was told to wait when we were talking about waiting it out. My youngest is almost 15 months. We've done Cairo and had her very thick ULT revised at 11 to 12 months, but we're still having latch issues. She refuses a deep latch and will pull back or push against me until the latch is shallow. Otherwise, she just latches off and screams at me. Is there still a chance that we can figure it out, even at this point, or am I doomed to recurrent mastitis and torn nipples?
Okay, so lots of issues there, and you know me, I'd be asking 15 questions. However, she mentioned upper lip tie, didn't mention tongue tie. I have never seen a lip tie without a tongue tie. I've seen thousands of tongue-tied babies. Now, a couple of my colleagues who I have incredible faith in have, so I know it's out there, but it's so uncommon that when mothers tell me they've had a lip tie revised without a tongue tie revised, I really second-guess the assessment. And sometimes you can't see the tongue tie until the baby's had chiropractic, and then that frenum pops forward. Okay, I'd go for another evaluation with a lactation consultant who's very knowledgeable. I would consider whether your chiropractor actually has the expertise with tongue tie, and maybe not. Great chiropractors aren't trained in tongue tie. It's not a condemnation on chiropractic. It's a very new thing for them. When I work with clients, because I work globally by Skype, I look for chiropractors in the areas where my clients live, and I call and talk to the chiropractors to find out what their knowledge base is with treating tongue tie. No, you're not doomed, but in terms of recurrent mastitis, I do want to mention that nothing is simplistic, and recurrent mastitis, in my mind, isn't only a baby issue. Most of the time, it also is correlated to maternal inflammation and maternal diet. So you could have, for example, a tongue tie, but you could also have a mom who's ingesting foods that her baby is sensitive to, and that baby is going to pull off the breast just because of those food intolerances. So you really have to look at the whole picture. Is there a food intolerance issue playing a role here, not just a structural problem?
Okay, awesome. Thank you for that. Another question. I have a 4-week-old today. He had a tongue and lip tie that was corrected at 2 weeks. We have struggled with blocked ducts and the pain from the nursing with the lip tie and tongue tie. Now we're struggling with vasospasms and rapid letdown. Do you have any tips for me?
So yes, again, I would want us to have somebody do a thorough evaluation of your feeding at breast, but when I do a consult, I always do a very thorough intake on mother's nutrition. So very fast letdown, just as an acute treatment, I would be looking at your whole diet and want to look at whether or not you have, a pro-inflammatory diet, which frankly most American women do. Magnesium can be a good acute treatment for an overactive milk ejection reflex, because think about it, that smooth muscle that surrounds those ducts, if that muscle contracts but doesn't release, which, magnesium allows muscle to relax, then you're going to have those very strong, painful letdowns, so magnesium. But, oxytocin is highly responsive in people who have gluten intolerance. So I would be looking at gluten as a possible cause of your overactive milk ejection reflex and possibly an inflammatory situation going on there. In terms of vasospasms, again, you've got to get the baby nursing properly, but vasospasms mean poor circulation. So again, you're going back to your nutrition. You're going back to your own gut health. L-arginine is an amino acid that is the substrate for nitric oxide production. Where you have too little nitric oxide production, you're going to have vasospasms. So when I have a client with vasospasms, as an acute treatment, even though we're also looking at what's going on in overall nutritionally, I suggest 500 milligrams of L-arginine 3 times a day. Look into whether or not you have, the only known contraindication, and the research doesn't really bear it out, is herpes. But you could take lysine in combination with your L-arginine anyway. So you could try that. But again, it's a Band-Aid. in that you still need to look at the whole nutritional picture.
Okay, awesome. Thank you so much. That answers so much stuff. In a 9-month-old, is there any reason to get a lip tie snipped even if the baby is not having issues breastfeeding?
Again, back to many questions here. What are not issues breastfeeding, meaning are you living with a lot of compensations? Because moms are amazing at meeting those babies at their compensation. So I'd want to know, is there really compensation going on? Yes. Dr. Kotlow's papers show that a lip tie is one of the key causes of dental caries in those front teeth, because the milk and then later food pools in that tissue around the lip and can cause decay of the front teeth. So there's that reason. There's also the lip. It impacts the entire musculature here. It's not just about what happens right in that middle area. So there could be muscular restriction because of lip. But again, I'm going to go back to, I don't see lip ties without tongue ties. Very, very rare. So if you've got a lip tie, I would almost guarantee you've got a tongue tie. But the long-term implications of tongue tie are airway development, speech development, postural development. We talked about these kids who can only army crawl because of their restrictions. You know, the tongue is a fascial issue that really originates in the sacrum. So you're talking about a whole body activation there. There are studies out of Italy where adults were revised, their tongue ties were revised, and their posture improved virtually overnight with no other interventions. So you've got a lot of long-term implications. And you know, the tongue posture is, a tongue is meant to be at the roof of the mouth. The tongue posture determines whether or not you can eat solid foods properly, whether or not you're going to develop a normal adult swallow, whether or not you're going to develop a healthy airway. So if you're going to snore, if you're going to you know, be congested all the time because you're not breathing properly and not making enough nitric oxide, the long-term implications are huge.
Correct.
So you want to look at the bigger picture.
For some reason, this wasn't charging this whole time. So I have it plugged in now, and it's working. But this one's going to die, so you might want to find another charger. Okay, so I don't have the other questions right now because he's grabbing. Do you see what he's doing right now? See if he's grunting and squirming?
Yep, but I think that, I think Corin sent you an email, right? Or a message about some things that we're thinking. Are you, Gena, are you there? Because it's frozen now. But what a great shot. It's frozen in a really great shot. So your hand is on his head, Gena. It should be at the nape of his neck, not on his head. Babies don't like you to hold their head. So he should be held at the nape of his neck so that he can get his head back. So that could be something that without inadvertently, you've been kind of pushing his head a little bit more into that forward posture without realizing it. So I haven't been watching you nurse long enough to know how much you've been doing that, but that hand always needs to be under the occiput at the nape of the neck, not on his head.
Like that?
Yeah, so I always do it like this. So one hand, you've got sort of your fingers coming around. So just like, just holding it, yes, yeah, as your finger comes around his shoulder like that and holds him at the nape of the neck. So that he can lean back on your hand, but he's not being pushed forward. You see what I mean?
Mm-hmm.
But again, I still think that his shoulders come up too far. He still moves too much from his entire scapula and shoulder girdle. He doesn't move freely enough independently. So I think that do you see what I'm saying? So whenever he tries to put his head back, he ends up having to push away in order to get an airway. So I think that there's still something structurally, and you can see it right now. I want to take a screenshot. I just did, because you can see how his shoulder is up to his ear, and everyone's watching could see this. His shoulder shouldn't be up to his ear like that. So there's still something going on where he's still some kind of compression in there that needs to be addressed. So I get, you know, what I would say is that it may be because he needs another release before the chiropractor can get a full chiropractic release. He may need that second tongue tie release. This may be as much as she can get if that tongue tie has reattached.
Okay, I'm all sweating.
You don't look it, honey. You look great.
No, it's just and that's the thing. It takes a lot, you know. this has been so freaking hard, and that's why I wanted to do this show. It's wearing me out. It's making me crazy. It doesn't make for like a wonderful marital back and forth because, if Craig wasn't so knowledgeable about breastfeeding, I could see him saying, why the hell are we going through all of this when we could just do formula?
You're absolutely right. You are. That is such an important comment. Is that moms? If you are a first-time mom, I mean, I'm watching him nurse. He's not a content nurser. He doesn't just kind of settle in and nurse and let you have that moment of like, oh, you're not getting. I'm watching you. You're not getting that oxytocin hit. Now I know you're doing a show, but the truth of it is the first time I've watched you nurse him. You don't relax into it because you're always struggling. You're always trying to get him on right and get him to, empty the breast right and all those things. And he's also still got, he's also still tilted. He's still tilted. And so I think he's probably got a mild torticollis that's still not resolved.
Yeah.
And, this is important though, Gena. I want to say this, that if you say you were that person who said, I can't do this anymore. The concern is he still, within his own being, is compensating. That compensation isn't going to go away, and it's going to carry forth into the rest of his life. And so, it could carry forward into things like, obstructed airway and snoring and later asthma and food allergies. Aside from the use of formula, you could pump your milk and put it in bottles. There's also the fact that there's something functionally, structurally not resolved with him that isn't going to go away because you don't breastfeed. And I think that's something that moms often don't realize is they give a bottle and they kind of mask what's going on with their babies, but it's still there.
I see, yes. It's not going to go away because of that, but I'm just grateful that I've come as far as I have, but it's only because I have lots of support from my friends and from here in my home and from my family. One last question. I was told. Oh no, I just read that one. I don't see a new one. Those two I saw. Like right now, what do you want, baby? Okay, it's we have about 9 minutes left in the show. I just want to let everybody know that you should be able to see underneath my screen a place to sign up for Jennifer's upcoming webinar. Jennifer, you can't see it here, but the
no, I'm looking at him. I'm just watching him. So.
Okay. What? So you should be able to see underneath our screen a place to sign up for Jennifer's upcoming webinar on birth into breastfeeding. I highly suggest that you watch it, that you sign up for it. You're going to learn a lot. I know you've learned a lot today. I know I do it every single time I talk to Jennifer. And I really encourage you to sign up for that and tell your friends about it. If you are a doula or a midwife watching, please tell your clients about it. Watch it yourself. There's for the price, you can't beat it, and the knowledge that you're going to get is going to be so incredibly important. And you can help moms like me who are just having a really stressful, hard time of this. It's not, we see these pictures of moms breastfeeding, and I have pictures of me breastfeeding, and the picture only shows 1 second in time. It doesn't show everything that's happening, and it's not always wonderful and blissful and great, and it can be really hard.
This is the way my daughter nursed, and I had no idea, Gena. I mean, she was like 12 before I knew she had a tongue tie. It's really, really hard, and we've got to educate more people, and you're doing an amazing thing of educating people, and we've just got to get this to be common knowledge so that mothers get help immediately, and that the practitioners know what they're doing, and we don't have these long, drawn-out, processes here. Gena, does he do better on one side than the other?
No.
No? He's still the same on both sides?
Yeah. Sorry.
Why are you sorry?
It's just so frustrating. Jeez. I want to just hold him while we're nursing and enjoy ourselves, and it's just hard. And so, anyways, that's why we're talking about this today. I want moms. Shoot, you know, Jennifer, I've been doing my radio show for almost 9 years. We started out AM and then we did FM. And the whole reason I started doing the show was because I wanted parents to know that they're not alone, that I get this is really freaking hard. Being a parent is the hardest job you'll ever have. I start every show by saying that. And I just want moms to know they're not alone, because when you think you're alone, when you think you're the only person having this singular experience, it's horrendous. That isolation that you feel like you're the only person who feels this way and that you're failing, and you want so badly to do what's best for your kids, and when you feel like you're all alone in it, it's horrible. It's a really dark and ugly place that you can go to when you feel that way. And I want so desperately for moms to know that they're not alone. And then after that, I want them to get good information. So that's why we're doing what we're doing. So if you're watching this right now, you can see that there's a register now button. Go there to register now for Jennifer's upcoming class on birth into breastfeeding. And she's going to be doing upcoming shows after that on tongue tie as well. And well, Jennifer, before we get into anything else, please, we only have like 5 minutes left. I know I wanted to talk about airways. You've been bringing that up too. What do you mean when you say airways?
Well, I mean, this is actually a revelation for me in the last couple of years as well, Gena. It's so much of this is new information. It kind of came from tongue tie and from watching babes like Jack and asking myself, what is going on with these little ones? And my own daughter, who's now almost 22, who nursed just like Jack does, but I had no knowledge. And unfortunately, she was my second baby, so I didn't give up. But like you think if it was my first baby, would I be able to handle this? And, you know, I nursed a tongue-tied kid for 5 years, and that first year was unreal. And so what I learned over time was that tongue-tie has such a huge effect on the progression of the development of everything in the body. In particular, the development of our airway, because the tongue must be elevated to the roof of the mouth in order for us to develop a normal, healthy airway. If you think about what breastfeeding does, of course, breastfeeding gets the tongue to elevate to the roof of the mouth. Bottle feeding pushes the tongue down. So right from the beginning, artificial feeding is a predictor of a poorly developed airway. And so what you'll see over time is the development of things like I said, like snoring, like mouth breathing, poor tooth placement and development, a high palate, sinus infections, ear infections, ADHD. I mean, these are all consequences of kids who can't sleep properly because their airways are compromised initially from either not being breastfed or being breastfed in a compensatory way, and tongue tie is a piece of that. It's not the only part of it, but it is a piece of it. So at least it's something we can take off the table. We can eliminate that problem and give these babies the best possibility to nurse well.
Can you tell everybody what to expect when they register for, as I was telling everybody to hit the gold button down below and register now for your upcoming class on birth
the birth and the breastfeeding one, actually that's something that you and I brainstormed together as a way to give birth folks an opportunity to really get some good breastfeeding information, to really understand what it is they're trying to protect in terms of breastfeeding, how they can really advocate for and educate their clients about getting breastfeeding working well, how they know where to make referrals. So it's basically, you know, what is the physiologic norm? How do we support the physiologic norm? What are the red flags? What are the yellow flags for where we need help? And then the tongue tie one really is an assessment of you know, how we know where a tongue tie might be an issue, how we know where to refer, who to refer to, how the tongue manifests in terms of the development of the airway, and what the long-term implications are. So I really want people to understand how important these issues are for long-term health and well-being, and how they can feel educated and become advocates and not feel so helpless, and also really so they can share accurate information, so they can become a voice for really good information and good support for women, whether it's just their friends, or it's their doula clients, or their midwifery clients, or their lactation clients. The birth and the breastfeeding webinars are CERP approved. The tongue tie one is not yet because I've just developed this one for you, for this client base. So So I'll apply for SIPs for that one too, but it hasn't been yet. We just brainstormed this based on your experience. So,
Yeah.
yeah.
And I'm so glad that we're doing it. And I said that wrong again. I'm telling you, Jennifer, this whole breastfeeding thing has me. I used to be a really smart lady.
You're still a smart
on
lady.
the ball. It's messed me up. But anyways, down below, the red button is for the breastfeeding, birth and breastfeeding webinar, and that gold one over there is for the tongue tie webinar. Sorry, I had it all screwed up. I say register for anything that Jennifer Tao's doing. I know I will for forever. Thank you, Jennifer, for joining me today and for talking about this stuff and just for being my friend and for being the voice out there that women can trust and you really care. I know you really care, and that means everything to me. To know women like you are out there and wanting to make a difference, and you are making a difference, and you've made a big difference in my life. So thank you. I love you.
Thank you, Gena. I love you too.
All right, we'll see you guys later. Thank you for joining us. I hope you'll join us for Hangouts in the future. Sign up now. Just sign up right now. We'll talk to you soon. Bye.